whole pumping thing. She gave me the permission to pump. I was pumping. It kind of helped to move things along. So that's why if you are like 35, 36, 37, 38 weeks, I would not even think about pumping because you do not want to trigger labor. That is just my opinion. Again, it should not be taken as medical advice, but due dates can really be off by as much as 2 weeks, and who wants to have a baby spend time in the NICU? I mean, it's really hard. I have friends who have had their babies in the NICU for some were lucky and it was only a couple days, some weeks, and some months. So just, it's not something that I would wish on anybody. Just please take the extra precaution. I know the end of pregnancy is daunting and you just want it to be over with. You just want not necessarily your body back because you'll probably never get it back, no offense, but you want it to be over with. You're so over it. You're tired all the time. You can't see your feet, can't put your shoes on, constantly out of breath. It's just, it's not pretty. So I totally get it. But if you could just find that little bit of oomph inside of you and just know that it's so close to being over, and by you holding out just a little bit longer, it'll be for the benefit of both you and baby. Okay, so I am going to go ahead and pick up my fussy baby, and I'm going to nurse her on one side, and I'm going to attempt to use the Haakaa or NatureBond or whatever you want to call it, the little silicone milk saver, on the opposite side. So she is a big baby, and I have actually not used this in a couple months now. So let's say a prayer. Hopefully she does not kick it off. Hopefully you don't kick it off. Okay, so let's see. It'd probably be easier for me to put it on the right side. So let's get all the hair out of the way before I lose my hair from her yanking it out. Okay, this one's for you. There you go. I also did not think my shirt through. Okay. All right, so now I'm going to fold it back and I'm going to squeeze in the middle and then squeeze it around my thumb. Now I'm going to place it directly in the center, fold this toward my breast, and let go. And it's pretty much hands-free once it's on there, especially with the suction. I don't see anything yet, but hi. Like I said, it's hands-free in the sense that you don't have to hold it for it to stay there because of the suction, but you definitely want to be careful, especially if little one is kicking or punching, or if it gets too full, because I feel like the moisture inside will definitely help it to loosen up its seal against your breast. And this should not be painful. So if it is, I would definitely unstick it and then reposition it. Try to get your nipple as close to the center as possible. Okay, so now I have a drop coming out. Here, come here. So this is what it's like being a mom, especially at the beginning. So let me just, you can see it's starting to feel a little bit, maybe you could see. But anyway, now she's gonna get curious. But with my first two, mainly with my first, they were saying that I was not making enough and all kinds of other stuff. But really, it wasn't that I wasn't making enough. It's just that they kept trying to get me to supplement with formula. And sometimes, yeah, it's true that, you know, if someone cannot produce or they're having a really hard time, that's one thing. But if you just had your baby, you need to keep in mind that your milk is not going to come in right away. Colostrum is all the baby needs. It's literally only a few drops and it's called liquid gold. You don't really need much. I can put up a little thing, a little picture from Google as to the size of the baby's stomach. I think it goes from like the size of a cherry to the size of a, I don't know, but it's so small. Like you really don't need much at all. And then it depends on how you birth. Not for everybody, but I've noticed that when I had a vaginal birth, my milk came in quicker than a C-section. What makes your milk come in is the delivery of the placenta. I've noticed that with my C-sections, I don't think my milk came in until somewhere between day 5 to 7, and that is normal. It's also normal for baby to lose a little bit of weight. Now, I'm not talking about a lot of weight, but a little bit is definitely okay. With my son, we were there in the hospital for 5 days because he had some pretty severe jaundice and he had to have the UV light therapy where they put like the little, looks like baby goggles over their eyes to protect it and stuff. And so in that time frame, he was only eating, obviously, the colostrum. And it was an emergency C-section. He had went down to, I don't remember how many ounces, but he went from 6 pounds, 13 ounces to 5 something. And then they said that aside from the jaundice that we really needed to get his weight up and they wanted me to supplement. And I kept trying with just breast milk. And I finally got him to 5 pounds, 10 ounces. And they said, okay, it looks like, you're doing better with your production. So I'm going to go ahead and let you take him home. And I was like, oh, thank God. Once we left there, within so many days, you have to go see a doctor. And when we went to go talk to his doctor, unfortunately, I wish that pediatricians were more educated in breastfeeding and car seat safety, because the things that I have been told and other people have been told are completely unacceptable. But the truth is that they have such little training on these two very important matters that are life-changing. They don't know enough to be able to educate. So instead of telling something that is not entirely correct or discouraging a parent, they should instead refer them somewhere else to get correct information from somebody who has studied it more in depth. My provider told me that I was starving my child and that breast milk is not enough for any baby and that I had to give them formula. See, this is what I was talking about. No, it's not a toy. See, I knew you were gonna be curious about it. She said, Mommy, what is that? I haven't seen that in a while. They were saying that I was starving my child and that breast milk is not enough for any child. And that's honestly, it's not true. Breast milk is definitely plenty. The more that you supplement, the more that you are gonna have problems breastfeeding because your body produces milk on demand. So the more that the baby drinks, the more that you expel from your breast, the more milk your body is going to produce, and the higher your chances of successfully breastfeeding, especially long term, are. So I'm really sad that I received, information like that from my pediatrician, and I thought that I trusted them. I'm glad that at the time things were not that great financially with me. My first pregnancy, although I had been trying for years with an ex and even did in vitro and everything, the circumstances were terrifying, and I was basically just doing whatever I could to live out this dream that I always had to be a mom. I may address that in a video in the future if I ever feel that I'm ready. So it was extra hard, and I just basically wanted a healthy baby, so I wanted to listen to my provider. I was not doing that well financially, so I made an appointment with WIC and I qualified for WIC, and thankfully, kudos, hands up to WIC, because they have a lactation consultant, and she basically had said that the information that I had received was all wrong. And that, it's a shame that providers tell their patients that, because it's not true. I was just like a sigh of relief, but at the same time, I was still just really discouraged and really disappointed. So I'm glad that I was able to make an appointment with the lactation consultant at WIC and get really accurate information. It probably saved my breastfeeding journey with my first baby. So I'm thankful for that. But the second pregnancy, third pregnancy, recent pregnancy with my daughter, I just used all that time to basically study on breastfeeding, study on pumping, study on things like this. I never even knew this existed, and maybe it is something that's new since my last pregnancy, but I love this. This is great. This is better than those little milk savers, the little circle things that just go right there and leak all over the place. Again, I don't even have to hold this. I'm just holding it because I'm leaning over and it's not getting full, but it's getting there.